Hi, today we are going to study about the pelvis. We need to know about the anatomy of the pelvis in obstetricals and midwifery nursing because if we have the awareness about this, we will be able to know about any deviation. Okay, so let's start. We will study about the pelvis, its structure and its joints and its ligaments. And also we need to study about the diameters. So let's start. Okay, we will start. This is a female pelvis. We can call it as pelvic girdle as well. So it is a basin shaped cavity. Moving forward to the function of pelvis, it's help in the body movements such as walking, running and sitting. And also it protects some organs like the reproductive organs which is situated in the pelvic cavity, then rectum and the urinary bladder. So the pelvis also helps to transmit the upper body weight to the lower limbs. So these are the function. Now next we will be moving towards the in details about the pelvis. So this pelvis is composed of, it is made up of innominate bones and sacrum and coccyx. So when we see about the innominate bones, there are two innominate bonds, one here, one at the right side and one at the left side. The innominate bonds consist of three bonds. That is, this will be the ilium, that is the uppermost part, and this is the ischium, this is the lowest part, and anteriorly there is pubic bone. So the innominate bonds is composed of ilium laterally, even ischium laterally, but pubic bone anteriorly. So in the both side there is a innominate bond which is composed of three bonds, ilium, ischium and pubic bone. So we will go in detail in the ilium bone. In ilium bone, where it is a large flared out part. It is a large flared out part. When we keep our hands over the hip, our hands rest on this iliac crest. This is known as iliac crest. This is the iliac crest. And in the anterior surface, we can see there is a small depression, concave shaped depression. It is known as iliac fossa. Now, at the anterior part of this iliac crest, we will be able to see two projections. One is anterior superior iliac spine, another one is anterior inferior iliac spine. Similarly, in the posterior aspect, there is two projections. It is known as posterior superior iliac spine and posterior inferior iliac spine. Now, this is about the ilium bone. Next, we are moving forward towards the ischium bone. It is the thickest and it is the lowest part in the pelvis. Thickest and lowest part. And this is the lowest most part, that is, it is known as ischial tuberosity. This is the part when we sit, our body rests on this projection, that is ischial tuberosity, is the most thickest tuberosity in pelvis. Okay, this is the ischial tuberosity. And just if we see, just above this ischial tuberosity, we will be able to see an inward projection that is known as ischial spine. This is ischial spine. Okay, just above to the ischial tuberosity, there is an inward projection that is known as ischial spine. Now here if we see, this is the ischial spine. From this ischial spine to this posterior iliac spine, there is one curvature, a curvature which runs from the posterior inferior iliac spine to the ischial spine is known as greater sciatic notch or greater curvature, through which the greatest nerve, that sciatic nerve, will pass. Okay. Likewise, there is one small curvature that extends from this ischial spine to this thickest part, that is the ischial tuberosity. This is known as lesser sciatic notch or lesser curvature. I think it is clear. This is a greater sciatic notch and this is the lesser sciatic notch, greater curvature or lesser curvature. Now, so that is about the ischium bone. Next, moving towards the pubic bone. This is the pubic bone. Here, this pubic bone forms the anterior part of the pelvis. So here, this pubic bone has got two parts. One is oar-like projection. This here you can see superiorly and inferiorly oar-like projection is there. This is superior ramus, this is inferior ramus, superior and inferior ramus. The another part is the body of the pubic bone. Here you can see this is the body of the pubic bone, this is the ramus. Here also the body and the ramus, superior and inferior ramus and the body. This two body of the pubic bone will join, articulates and forms a joint that is known as symphysis pubis. Okay, now next we will move forward. Here you can see there is one foramen is there, obturator foramen. This obturator foramen is bounded by, now you can name this part, that is superior ramus, inferior ramus, body of the pubic bone and ischium. So the foramen which is bounded by superior ramus, inferior ramus, ischium bone and the body of the pubic bone is known as obturator foramen. Here also you can see this is obturator foramen, superior, it is bounded by superior ramus, inferior ramus, body of the pubic bone and the ischium bone. Okay. Now here you will be able to see there is a cup-shaped depression. This is known as acetabulum, where the head of the femur will come and join to form the hip joint. And this acetabulum, it is formed from the contribution of three innominate bones, that is ilium, 2/5 part of the ilium bone, 2/5 part of the ischium bone, and 1/5 part of the pubic bone. So this will contribute and form this cup-shaped depression that is known as acetabulum. Okay. Now, next, apart from the innominate bones, the pelvis is formed by sacrum and coccyx. You know this is the vertebral part. The lower vertebral, this is the sacrum. And the sacrum is a wedge-shaped bone. It consists of five fused vertebra. The upper border of the first sacral vertebra, it is, this first sacral vertebra, it is prominent forward. Forward it is prominent, it guts forward. This is known as sacral promontory. So, and the anterior surface of this sacral vertebra, it has got some holes. You can see here the holes are there. This is known as hollow of the sacrum, through which the coda equina will emerge to supply the pelvic organs. The coda equina will be emerging through these holes and it will supply the pelvic reproductive organs which is inside the pelvic cavity. And then the anterior surface is concave in shape, whereas the posterior surface of the sacrum will be rough because it has got attachment with the muscles. Now the coccyx. Coccyx is the lowermost part. It is also a part of vertebra. It is known as vestigial tail. It is triangular in shape. Okay, it consists of four fused vertebra, whereas the sacrum is wedge-shaped bone and it's formed by five fused vertebra, whereas this coccyx is vestigial tail. It is formed by four fused vertebra and it is a small triangular bone. It articulates with the fifth sacral vertebra, segment. Okay, that is about the coccyx. Now, we also need to know about the joints which is formed in this pelvic cavity. Now, here there is one joint, that is sacroiliac joint. It is formed in between the sacrum and the ilium bone, sacroiliac joint. Then there is another joint, that is interpubic ligament, symphysis pubis, which is in between the pubic bone, symphysis pubis. And there is another joint, that is sacrococcygeal joint. Okay, then moving on towards the ligaments. In ligaments, there are sacroiliac ligament that extend from the sacrum to the ilium bone, then interpubic ligament, then sacrococcygeal ligament, then sacrotuberous, that is from sacrum to the ischial tuberosity, sacrotuberous ligament. Then likewise there is sacrospinous ligament, which is from sacrum to the ischial spine. So these are the ligaments. So once again the joints are sacroiliac joint, to right and left sacroiliac joint, symphysis pubis and sacrococcygeal joint. Ligaments, sacroiliac ligament, 2, sacrococcygeal ligament, sacrotuberous ligament, Sacrospinous ligament. Sacrospinous ligament, it is from the sacrum to the spine. And here interpubic ligaments. So one thing I forgot to tell, that is here in the sacrum, as I said, the first sacral vertebra is jutting forward and it is known as sacral promontory. And in the lateral side, you can see two wing-like structure that is known as sacral ala, or otherwise we can call it as sacral wing, sacral ala or sacral wing. So that is about the pelvis, bones, joints and ligaments. So this is about the pelvis, anatomy, the joints and the ligaments. Okay, so now we will continue. This pelvis, it is divided into two parts. The pelvis, as there is two type of pelvis, true pelvis and false pelvis. The true pelvis is the bony canal. True pelvis is the bony canal through which the fetus must pass during the birth. So the way through which the fetus is passing during the birth, this part will be known as the true pelvis. Whereas the false pelvis will be above this part, above the true pelvis, whatever part will be coming, that will be called as false pelvis. So this true pelvis is a bony canal through which the fetus must pass during the birth. This is known as true pelvis. Now, this true pelvis is divided into three parts. The first is pelvic brim. This will be this boundary, and this is the cavity, and after cavity, the outlet. So the true pelvis is divided into three. The brim, this brim, which is otherwise known as pelvic inlet, pelvic cavity, and pelvic outlet. So true pelvis is divided into three: pelvic brim or inlet, pelvic cavity, and pelvic outlet. Whereas the false pelvis is the part which is above this pelvic brim. You can see this is a pelvic brim, this boundary. But above the part, you can see this ilium bone, flayed out part. This one and this part, and even at the front there will be rectus abdominal muscles, rectus abdominal sheet, that will come under the false pelvis, but it will not be having any obstetrical significance. Okay, and now we are going to study about the most important part in the pelvic brim. This pelvic brim is the landmarks of pelvic brim, which is very, very, very important in the practical aspect. Okay, so if we see the pelvic brim, you know it is, this is the boundary. This is the pelvic brim, otherwise known as pelvic inlet. So for your reference, I would like to say that in order to explain about the landmarks of pelvic brim, I referred the Miles textbook for midwives, because I explain why I am explaining this is because in Datta, if we see in Datta textbook, there 9 landmarks will be mentioned, but here I will be focusing on the 8 landmarks which mentioned in the Miles textbook and even in the textbook of Annamma Jacob. Okay. So in the pelvic brim, the landmarks, I will explain one by one. There are 8 landmarks in the pelvic brim, and being a midwife, we need to be familiar with this fixed point on the pelvic brim, and this fixed points we will call it as landmarks. So now we will start from the posterior part. This is the posterior, this is the anterior part. So we will be starting from the posterior part. The first one is the sacral promontory. This is the sacral promontory. Next is sacral ala or sacral wing. Then sacroiliac joint. Then here one boundary is there. This boundary is known as, this is the edge. This is known as iliopectineal line. Iliopectineal line. After the sacroiliac joint, the another landmark is known as iliopectineal line. And after this line, there is one small projection. It is known as iliopectineal eminence. It is a roughened surface. Okay, now next boundary, next landmark will be this one. It is known as superior ramus of the pubic bone. Already we have explained while explaining the anatomy. This is the superior ramus of the pubic bone. Then moving forward, the next landmark is upper inner border of the body of pubic bone. You know this is a pubic bone. So we are telling about the boundary landmark. So here upper inner border of pubic bone. Upper inner border of body of the pubic bone. The next landmark, the last landmark will be upper inner border of the symphysis pubis. So these are the 8 landmarks. Once again I will repeat. This is the sacral promontory. I am starting from the posterior aspect. This is the sacral promontory. This is the sacral ala or otherwise sacral wing. Then sacroiliac joint, another landmark. Next, there is one boundary, that is a edge, that is iliopectineal line. Here small projection is there, iliopectineal eminence. Then this is the superior ramus of the pubic bone. Then here upper inner border of the body of the pubic bone. The last one is upper inner border of the symphysis pubis. So these are the 8 landmarks in the pelvic brim or pelvic inlet. It is very important. So 8 landmarks in the pelvic brim or pelvic inlet. Okay, just now we discussed about the different landmarks which are present in the pelvic brim. So now we will see the diameters. The diameters in the female pelvis, so which has got a practical significance in midwifery. Okay, so each diameter we have to we will see the each diameter. So first, as I said in the previous sections, that the pelvis is divided into the true pelvis is divided into brim, cavity and outlet. So first we will see the diameters present in the pelvic brim. So mainly the principal diameters will be anteroposterior, oblique and transverse. Once again, anteroposterior from front to back, then the oblique, then transverse. Okay, anteroposterior, oblique, then transverse. These are the 3 principal diameters. So each we will be discussing now for the pelvic brim, pelvic cavity and pelvic outlet. So in the pelvic brim, this is the pelvic brim. In the pelvic brim, the diameters, as I said, the first will be, we will be seeing the oblique diameter. Oblique means like this. So we have to we need to focus on the brim. We are now telling about the diameters in the pelvic brim. So oblique diameter means it extends from sacroiliac joint to this iliopectineal eminence, which we told during the landmarks. So sacroiliac joint, this is a right sacroiliac joint. From right sacroiliac joint to the opposite side of iliopectineal eminence, that is the left iliopectineal eminence. That is the oblique diameter in the pelvic brim. That is 12 centimeter from right sacroiliac joint to the left iliopectineal eminence. Likewise, from this left sacroiliac joint to the right iliopectineal eminence. So this is the oblique diameter in the pelvic brim, that it is about 12 centimeter. Now next is the transverse diameter. Like this transverse diameter, it is the 2 farthest point of the iliopectineal line. As we know that this is iliopectineal line, this is the iliopectineal line. So the 2 farthest point of the iliopectineal line is the transverse diameter, that is 13 centimeter, or otherwise we can say it is the widest diameter in the pelvic brim, that is 13 centimeter, that extends from the iliopectineal line to the other iliopectineal line, that is the 2 farthest point of the iliopectineal line, that is about 13 centimeter. So this is the oblique one. This is the transverse one. Now we need to see the anterior posterior diameter from front to back, like this. So here the anterior posterior diameter, we can call it also as conjugate diameter. In the conjugate diameters, there are three conjugate diameter. One is the anatomical conjugate, second one is obstetrical conjugate, and third one is the diagonal conjugate. Okay, so in generally the anterior posterior diameter will be from the sacral promontory to the uh, symphysis pubis. Okay, so here first one is anatomical conjugate, that is from the sacral promontory to the upper portion of the upper border of the symphysis here, from the sacral promontory to the upper border of the symphysis pubis, that is anatomical conjugate. It is 12 centimeter from here to the upper border of the symphysis pubis, that is anatomical. The second one is obstetrical, which has got obstetrical significance. That will be the starting point will be sacral promontory itself, but it will be midpoint of the symphysis pubis, inner. Just this is the outer region, but we will be seeing the inner region. That is, this is the upper border. Now inner region here, 1.25 centimeter below the upper border, or otherwise we can say it as midpoint of the symphysis pubis, from sacral promontory to the midpoint of the symphysis pubis, that is about 11 centimeter. This is the obstetrical conjugate. Now next we are going to see the diagonal conjugate in the anteroposterior diameter, that is from the sacral promontory to the lower border of symphysis pubis. This is the lower border of symphysis pubis, from sacral promontory to the lower border of symphysis pubis, that can be 12 to 13 centimeter. Okay, so this is about the diameter in pelvic brim or pelvic inlet. Once again I will repeat, that is the first diameter, oblique diameter, that is from the right sacroiliac joint to the left iliopectineal eminence, or from the left sacroiliac joint to the right iliopectineal eminence. That will account about 12 centimeter. And the transverse diameter is the distance between the iliopectineal line, that is the farthest point of the iliopectineal line. It is about, this transverse is about 13 centimeter. Okay, now the anterior posterior diameter, it is also known as conjugate diameter, and this conjugate diameter there are three. The anatomical conjugate, that is from the sacral promontory to the upper border of the symphysis pubis. Now the obstetrical will be sacral promontory to the middle portion of the symphysis pubis, 1.25 centimeter below the upper border, that is about 11 centimeter. And the diagonal conjugate is from the sacral promontory to the lower border of symphysis pubis, that is 12 to 13 centimeter. That is about the diameter in the pelvic brim or pelvic inlet. Now next we will see the pelvic cavity. As you know, this pelvic cavity is circular in shape. So for any circle, the diameter will be same, even if it is anteroposterior or diagonal or transverse, or it is whatever it is, everywhere the diameter will be same. So it is circular in shape, so it is considered as, we are taking the diameter as 12 centimeter. Okay, so as the pelvic cavity is circular in shape, and although it is not possible to measure its diameter exactly, they are all considered to be 12 centimeter. That is about the pelvic cavity. Now we are moving forward to the pelvic outlet. So this is the pelvic outlet. In the pelvic outlet there is, next we are going to see about the pelvic outlet. This is the outlet. So here in the outlet diameters, actually there are two outlets. It is anatomical outlet and obstetrical outlet. Okay, so this anatomical outlet is covered by sacrum, coccyx, ischial tuberosity, and ischial spine. So here you can see the anatomical outlet includes coccyx, sacrum, this both, coccyx and sacrum. Then there is two ischial tuberosity and this two ischial spine. So that is the anatomical outlet. Outlet is divided into two, anatomical and obstetrical outlet. Anatomical outlet is from the sacrum and coccyx. It is bounded by sacrum, coccyx, then two ischial spines and two ischial tuberosity. Okay. Now moving on towards the obstetrical outlet. In obstetrical outlets, it has got obstetrical significance, practical obstetrical significance it has got, because through this, there is one narrow pelvic strait through which the baby will pass. So in the outlet, as I said, there is anatomical and obstetrical outlet. Anatomical outlet already told, it is bounded by so and so things. But when we talk about the obstetrical outlet, we need to talk about one thing, that is narrow pelvic strait. So this narrow pelvic strait is the strait through which the baby must pass. The fetus must pass through that narrow pelvic strait. So this narrow pelvic strait, it includes, it is between sacrococcygeal joint here, the joint which is formed by the sacrum and coccyx. So sacrococcygeal joint to this lower border of the symphysis pubis. Okay, it is between the sacrococcygeal joint and then lower border of the symphysis pubis and two ischial spine. Here you can see from here, from to the ischial spine to the lower border of the symphysis pubis. So here this will be, this is the narrow pelvic strait. Here from sacrococcygeal joint to the two ischial spine, this protrusion, this two inward, down inward. There is one protrusion, that is ischial spine, and to the lower border of the symphysis. So this, like this, okay, like this diamond. This is actually the narrow pelvic strait. And just before that, we discussed about the anatomical outlet. So one is missing. We did not discuss about obstetrical outlet. So obstetrical outlet is the space between anatomical outlet and this narrow pelvic strait. Okay. Once again, I will repeat this outlet. There are two outlets, anatomical and obstetrical. Anatomical outlet is covered by sacrum and coccyx to ischial spine and ischial tuberosity. Okay. Now, then when we talk about obstetrical outlet, before that we need to explain regarding narrow pelvic strait. It is the strait through which the baby must pass. So that narrow pelvic strait is from the sacrococcygeal joint to ischial spine and this lower border of the symphysis pubis. Like this, it will come. So the space between this narrow pelvic strait and anatomical outlet is known as obstetrical conjugate. So the space between narrow pelvic strait and anatomical outlet is known as obstetrical outlet, and it will be diamond in shape. That is about obstetrical outlet. Now we are moving on towards the diameters. So in diameters, as I said, there are three diameters: anterior posterior, anterior posterior, oblique, and transverse. So these are the three diameters. In that first anterior posterior diameter is from, now we should be careful. We are telling about the outlet. So here will be. So from it will be from the sacrococcygeal joint to the lower border of symphysis. That is the anterior posterior diameter. It is about 13 centimeter. It is about 13 centimeter. It is from the sacrococcygeal joint to the lower border of the symphysis pubis, 13 centimeter. And one peculiarity is that when the baby will be passing through the pelvic cavity to the pelvic outlet, what happens? The sacrum will be deflected backward. The sacrum will go backward. So that time this diameter, what we told 13 centimeter, it will increase so that it will get enough space. The baby will get enough space to come out of the pelvic outlet. Okay, so pelvic outlet is from the sacrooccipital joint to the lower border of the symphysis pubis. It is 13 centimeter, but during delivery, as a fetus descends downward, what happens? This says pockets. This vertebra will be deflecting backward, and the diameter will again it will increase. So that is the anterior posterior diameter in the pelvic outlet. Next, we are going to see about the oblique diameter in the pelvic outlet. Oblique diameter is from obturator foramen to the sacrospinous ligament. Sacrospinous ligament is from sacrum to the ischial spine. So there, here you can see, this is the sacrum and there is the ischial spine. So as we said earlier in ligaments, we said there is one ligament which extends from the sacrum to the ischial spine, that is sacrospinous ligament. So in outlet oblique diameter, see here, through the obturator foramen to the opposite side sacrospinous ligament. That is the oblique diameter here, oblique. Okay, so from this to this, that is oblique diameter of the pelvic outlet. And that is about 12 centimeter. Okay, Now, next is the transverse diameter. The transverse diameter will be between, of the outlet will be between two ischial spine. And that is, as we know, the ischial spine is inward projection. So the diameter will be very less, that is 11 centimeter. This is the distance between two ischial spine is the transverse diameter in the pelvic outlet, that is about 11 centimeter. So that this is the diameter in the pelvic outlet. So once again, I will repeat. So in the brim, there is anterior posterior diameter. Okay, sacral promontory to the symphysis pubis, and here we will call it as conjugate diameter also. There are three conjugate anatomical, that is from sacral promontory to the upper border for the symphysis pubis. Then the obstetrical will be from the sacral promontory to the midpoint of the symphysis pubis, and the diagonal will be from the sacral promontory to the lower border symphysis pubis. Here the obstetrical diameter, obstetrical conjugate will be, that is here it will be 11 centimeter. Okay, now transverse is the widest one in the brim. So it will be the two farthest point of the iliopectineal line. And the oblique will be from the sacroiliac joint to the opposite side of iliopectineal eminence. Okay, that is oblique will be 12 centimeter. Okay. Now, next is cavity. As we said, it is circular in shape, so it is not possible to measure the each diameter. So we are considering the all diameter as 12 centimeter. In the outlet, this is the outlet, outer part. So here, we have to say there is two outlet, anatomical anatomical outlet and obstetrical outlet. Anatomical outlet is from the sacrum. It consists of sacrum, coccyx, lower border of the symphysis pubis, ischial spine. Okay, and ischial tuberous. These all things are included in the anatomical outlet. Whereas when we tell about the obstetrical outlet, before that we have to say about the narrow pelvic straight. Narrow pelvic straight is from the sacrococcygeal joint to the two ischial spine to the lower border of the symphysis pubis. From here, from two ischial spine to here, from here, from here, from here, from here. So that is that. And the obstetrical outlet is the space between the anatomical outlet and the narrow pelvic straight, and it is diamond in shape. Then we have to tell about the diameters. In the diameter, there is anteroposterior diameter. It is from the sacrococcygeal joint to the lower border of symphysis pubis, 13 centimeter. And when the labor takes place, as the fetal head descends, the sacrum, the coccyx will go backward, deflected backward, and here the diameter will again increase. And then the oblique diameter is from the obturator foramen to the sacrospinous ligament. Here the sacrospinous ligament is there. So from here to here, this is the oblique diameter, that is 12 centimeter. The transverse diameter, it is between the two ischial spine here, this two ischial spine. It is, or we can also call it as bispinous diameter. So it is smallest one, narrowest diameter in the pelvic outlet, that is 11 centimeter. So this is about the diameters in the pelvis. Okay, I think it is clear for you. So this is a female pelvis. It is basin-shaped cavity, and it is formed of innominate bones and one sacrum and coccyx. Innominate bones include cilium, ischium, and pubic bone. Then sacrum and coccyx. Okay. Then there are joints, sacroiliac joint. Then two sacroiliac joints, sacroiliac joint, and interpubic ligaments. Okay. Then there are interpubic ligaments are there, sacroiliac ligament are there, sacrotuberous ligament is there, and sacrospinous ligament is there. Then the pelvis, true pelvis and true pelvis is below the brim. Brim, cavity and outlet will come under true pelvis, whereas the other part, which is above this thing, this will come under the false pelvis. It doesn't have any obstetrical significances. Okay. Then we discussed about the landmarks in the pelvic rim. The landmarks, sacral promontory, sacral ala or sacral vein, sacroiliac joint, iliopectineal line, iliopectineal eminence, superior ramus of the pubic bone, upper inner border of the body of pubic bone, upper inner border of the symphysis pubis, with 8 landmarks. Then the diameters we explained, then diameters of pelvic cavity, then diameters of pelvic outlets. So that is this is about the female pelvis. So in examination, you will be told to explain about the female pelvis. So you are supposed to explain all this thing, even any specific diameters can also be asked for you. So you should be confident enough to explain regarding this. Okay, so that is the end.